NASS's work is absolutely crucial to support all of those who might have the diagnosis of axial SpA, but also to support family of those patients, but also the wider healthcare community as well, with their understanding of the condition and how we should be supporting and managing these patients throughout their journey. I'm a trustee for NASS and medical advisor for NASS, and also chairman of A-Stretch, which is a group of physiotherapists that work nationally with patients with AxSpA. In my role as physiotherapy specialist for rheumatology, I very much specifically work with AxSpA patients. If I'm honest, there's too many to mention because NASS does so much stuff. It's amazing. So the website as a whole is obviously an amazing resource. I really very specifically, though, like the self-management videos that have come out of the work that NASS did during COVID. I think they were amazing during COVID, but the legacy of those videos now carries on now. I refer to lots of those videos very specifically for individual patients. So rather than just saying, look at all of the videos, I might see a patient, for example, that's particularly struggling with TMJ, jaw symptoms. And I know that there's a video about that on that resource, so I can send them that way. My other resource is the support from the helpline, and knowing that patients don't necessarily need to be members of NASS to access that support, I think can be really invaluable. And also the work that NASS does for patients with regard to benefits, because as healthcare professionals, we don't know how to navigate necessarily that element. I think the importance of the guidebooks is not only just for those that are already diagnosed with axial SpA. I think having them even in GP practices, health centres, that kind of thing, it might spark somebody to think, I wonder what that is, and pick it up, or, you know, for themselves or even for their loved ones if they haven't made contact with NASS, etc. So I think it's important everywhere. I don't think we can underestimate for some patients how they physically like to have a guidebook as well. Whilst IT is amazing and we need to be, you know, paper conscious, there is something about a physical printed thing that they can take away that some patients absolutely value. I think the guidebooks in a physical form are still really, really important, but knowing also we've got the backup of the website page if we need it. I think the really big thing is about your family and friends, or particularly your family maybe seeing it and thinking, I wonder what that is. And that increases their education and understanding. So we do try and encourage patients to bring family to their appointments, but a lot of patients don't like to. They like to keep it a bit private, don't they? Or they don't know how to explain to their family members. So I like to give a physical copy so they can maybe even pass it on to their loved ones and say, look, this is what I'm dealing with. I find it really hard to speak to you about it, but I'd really like you to read this section about fatigue. People find it really hard to acknowledge fatigue potentially being part of their condition, and how they, in their family setting, tell their loved ones, actually, I'm really struggling today because I feel really fatigued. I may look normal to you on the outside, I'm really struggling. And if they can't have that conversation, sometimes handing them the book and saying, could you just read this for me? I think it can be really, really beneficial for a lot of people. NASS can also link other healthcare professionals together. So the charity will have an idea of the wider network of healthcare professionals that may be working with this patient group. That peer-to-peer support is really invaluable as well, not least to understand how other services are working and what might be really good practice out there that we could look at adopting in our own areas. I will often come to NASS and say, got this patient that's asking this question. Is this something you could put out to the wider medical advisory group or even to the patient forum to see what feedback we get, so I can then pass that support on to my patient, for example? NASS's wider role is really important in terms of other healthcare providers, not just those sat in the NHS world, FCP, osteopathy, chiropractors, GPs, all sorts of different people. Their work is key at raising the profile of the condition, but also the awareness in healthcare professionals. If there is any money that you can donate to the Winter Appeal to help support us with our staff in NASS and the amazing work that they do, from producing resources to training sessions to running the website and the Facebook Live sessions that they run, any money that you can donate would be really, really welcomed.